Grounded planes, empty shelves and cancelled trains, scenes the government is keen to avoid. But in a sign that they see a challenging few weeks ahead, the Prime Minister today announced a new testing regime.
We've identified 100,000 critical workers in areas from food processing to transport to our border force. And from the 10th of January, we'll be rolling out lateral flow testing for all these workers, available on every working day. We'll be sending testing kits directly to these organisations and liaising with them on the logistics.
The Prime Minister acknowledged too the pressures on the NHS, saying they were identifying trusts that might need military support, and yet he said the country can ride out this wave.
As our NHS moves to a war footing, I will be recommending to Cabinet tomorrow that we continue with Plan B, because the public have responded and changed their behaviour, changed your behaviour, buying valuable time to get boosters in arms and help the NHS to cope with the Omicron wave.
Boosting remains at the heart of the government's strategy, but there are concerns that it's flatlining. NHS England revealing there are more than 2 million slots available over the next 7 days. Preparing for opening schools this week has involved setting up testing hubs. At Nicholas Breakspear Catholic School in St Albans, they were going to do it all in one day, but that had to be abandoned.
Because of the staffing shortages, we're unable to do that. So we've had to create a test centre like this. I think it's our third or fourth time that we've created this test centre where the children will come in tomorrow, but we've had to do it in stages. So we've got the exam groups, so year 11, year 12 and year 13 in tomorrow, and then the rest of the school will come in gradually, and we should have everyone tested, or everyone who's eligible for testing, by Friday.
And the head teacher said they were preparing in case they had to close the school.
We've moved to sort of remote learning for this week as we do the testing. So those students who are not coming in tomorrow, they will be having remote learning. But we are mindful because as a community, we've lost grandparents, we've lost parents, and we've lost a colleague because of COVID. So we're fully aware of the dangers that COVID offers to a community.
Testing remains critical as COVID cases today passed 218,000, albeit taking in holiday backlogs.
Even as schools are preparing to open, and some of them are delayed, the government is having to look at other sectors, the health service, of course, transport, even bin collections, because sickness rates are high, case rates of Omicron are at record levels, and the data isn't yet clear enough to show when this might begin to slow down.
Across England, a number of trusts have declared critical incidents. Blackpool Teaching Hospitals Trust said it was experiencing high demand and long waits for A&E and other urgent care. And the declaration of a critical incident was, they said, an attempt to alleviate the pressure we are under, including stepping down some non-urgent activity in order to deliver all of the things we can and need to do to provide the very best care possible. And while some had hoped that the Omicron wave had reached a peak in London, the data does not show this, with cases now rising in older age groups and numbers outside the capital also spreading rapidly.
Well, just before the Prime Minister's press conference, I spoke to the Education Secretary, Nadeem Zahawi, and I began by asking him how confident he was that schools could avoid a return to online learning.
At the end of last term, teacher absenteeism was running at about 8%. Of course, that will increase because Omicron, initially the epicenter was London, and now we're seeing obviously spikes emerging in other parts of the country, and we're keeping a very close eye. It's going to be a bumpy couple of weeks, but I think together we can manage to continue to keep schools open.
I appreciate you can't give a cast iron guarantee because you don't know what's going to happen with the pandemic. If you're getting, up to 25% teacher absences, which I know is your contingency plan, that would necessitate a move to online learning, would it not?
So, as I said earlier, we were running at about 8% at the end of last year. That will go up, certainly. Part of my communication with the frontline was to sort of make sure they think of all the options available to them to keep children in school, including, merging classes or teaching in a bigger space, a greater number of students for temporarily.
When you look at the number of students who have been off sick, the number of staff off sick, you're talking about combining classes, which with the best will in the world is not ideal to have larger classes with fewer teachers. Yet you're still expecting A-level students, GCSE students to sit exams this summer pretty much as normal with a few tweaks. Is that really fair?
Yes, I think it's the right thing to do. And I've worked very closely with the regulator, with Ofqual, to make sure that the grading reflects that disruption that those students have had to their education, making sure that, yes, of course, we want to get to pre-COVID levels of grading, but we're going to do it in 2 steps rather than a single step.
But should that step actually be paused, rather than trying to move on? We're still in the pandemic.
I hear you, but I think actually it is the right thing to do to make sure that those students who have been, yes, having disruptions, but have been preparing for the summer exams. By the way, we've also got for the vocational qualifications, we've got exams in January, and we will make sure those go ahead.
Now, your previous job was spearheading the vaccines drive. Fewer than half of 12 to 15-year-olds, according to the latest figures, have had even a single jab. Do you fear that anti-vaxxers might have bullied parents and students themselves?
So I've been talking this morning to Directors of Public Health. One of the issues we discussed is anti-vaxxers, and I think the best way to deal with them is to share the information that parents need, that students need, and to make it publicly available, accessible to them, rather than engaging on the sort of the turf of that, the sort of the mad anti-vax, people who really are talking nonsense.
When you look at the number of pupils and teachers being sent home, you look at problems with bin collection, some suggestions that there's problems with some food supply chains, again, trains cancelled. It's clear, isn't it, that Omicron, while less of a threat to public health, is a significant threat to society and the way we're living. So do you hope that eventually you'll be able to reduce that isolation period, to reduce the disruption to society, particularly in schools?
So we have to be careful with that. And the UK Health and Security Agency have done a really good blog on this. And for your viewers, they should look that up in terms of the 7-day isolation period brought down from 10 days. Because some people have been saying, why don't you do the same as the United States of America with have a 5-day period? Actually, we're not comparing like for like, because our isolation period begins when you get symptoms. In the States, they begin isolating when they get a positive test. And so the danger, if you bring that isolation period down from 7 days to 5 days, is you might then have exacerbated the infection spike, because people will then come out of isolation too early and still be infectious.
Nadeem Zahawi talking to me earlier. Well, I'm joined now by Professor Paul Hunter, an epidemiologist at the University of East Anglia. Professor Hunter, I wanted to ask you first about this plan that the Prime Minister set out to test 100,000 key workers a day. Will that help keep public services moving, or might it actually have the opposite effect, that lead to more people with mild or asymptomatic illness self-isolating and bring things to an even further halt?
Well, no, that is certainly a significant risk, because if you are testing on a daily basis, you will undoubtedly pick up more people who have had the infection, who might, if on a weekly basis, they might have had their infection and recovered from it before between samples. So yes, it does have the risk that it could increase the number of people who would have to self-isolate.
So does that suggest then that the Prime Minister is actually more worried about the NHS falling over than he is about, what his backbenchers are calling a de facto lockdown, with public services like transport and so on, supermarket supplies grinding to a halt?
I don't know. I mean, it is a very difficult situation that we're in at the moment. Yes, Omicron is a lot less severe than previous variants, but it is more infectious and we're seeing far more cases. It's very difficult to judge when the peak will occur. The models that we've seen, the producers, particularly one from Warwick, is suggesting that we will see a peak infections pretty early in this month. And if that's right, then I think we can relax as we move throughout the month. But, it is still uncertain. I think one of the key things that the chief medical officer pointed out today is that although cases as a whole may be in decline in London, it's still the more vulnerable groups, the over 60s, that are where we're seeing still continued growth. And of course, those are the groups that are going into hospital. But implementing further restrictions at the moment might not actually do anything to reduce the coming peak, but can certainly extend the duration that we will live with Omicron at high levels. So it's not an easy balance to make.
So how soon would you hope to see more relaxations after that peak, you said? I mean, are we looking this month? Might it be feasible, for example, to reduce the self-isolation period?
If the Warwick model is correct in predicting that we would see the substantial peak in the next week or so, then followed by significant declines, and I think we would be looking to substantial relaxations of restrictions as early as the end of the month, early February. But that is a big if. And whether or not we do see that peaking earlier is something that we will have to wait a few more days to find out.
Right, it'll be a tense wait. But do you agree with the Prime Minister's general assessment that we can probably ride this wave out without going back into lockdown at any point?
Yeah, I think so. And I think the problem is that as I said, when you get something like Omicron, which is so infectious, ultimately, we're all going to be exposed to Omicron at some point. And if it's not this month, it'll be later on in the year. And so the issue is whether we can actually get this thing over with earlier, providing that doesn't provide too much of a stress on services and too much of a stress on the health service, or is it more important to reduce that initial peak, but at the risk that we're going to have to live with this for somewhat longer? And that's effectively the question at the moment. And it's not an easy question to answer, because we still are not sure how high this peak in hospitalization rates will go and how high infection rates will go before they ultimately, and they will, peak and subsequently decline on the other side.
How, if you do let Omicron sort of rip through the population, sooner rather than later, how big is the risk of another new variant of concern? Or do you think now it's much more likely that a new variant will be milder even than Omicron and we get to an endemic phase sooner?
Yeah, I think we will see new variants of SARS-CoV-2, the virus that causes COVID, for many years to come, because we see that with the other coronaviruses. Viruses that are very similar to the COVID virus mutate and throw off what's called escape mutations, every year or two, and we will see that. But that doesn't necessarily mean that they're going to cause the problems that we've seen here. And although we are going to see new variants, many geneticists would agree that actually those are unlikely to be variants of concern, in part because the immunity to severe disease is more durable. It relies more on T cells, which killer T cells, which last longer and provide longer duration against severe disease, whereas the protection against mild infections, which is an infection of the nose and throat, tends to be much more shorter lived. So yes, we're going to see further waves of SARS-CoV-2, the virus, but hopefully with each wave, it will be less and less severe, and we'll ultimately just treat this as another cause of the common cold.
Professor Hunter, thanks very much for joining us.
My pleasure.